Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Hi, I'm Pat Loehrer. I'm Director of the Center of Global Oncology and Health Equity at Indiana University.
I'm Dave Johnson at UT Southwestern in Dallas, Texas. Pat, great to be back with another episode of Oncology, Etc., an ASCO educational podcast. We have a very special guest today, Dr. Richard Pazdur from the FDA Oncology Center of Excellence. Really looking forward to this conversation.
This will be terrific.
Yeah. So you were telling me before we got started a little event that occurred this week. Maybe you want to elaborate on that for us.
Yeah, we always start out this by talking about books. And one of the books I'm drawn to today is a book called The Emperor of All Maladies, which was written by Dr. Mukherjee several years ago. I want to read a little bit from this because it has pertinence. This is about a guy named John Cleland. As Mukherjee writes, he goes, in 1973, Cleland was a 22-year-old veterinary student in Indiana. In August that year, 2 months after his marriage, he discovered a rapidly enlarging lump in his right testis. He was whisked off to the operating room for surgery and returned with a scar, and he was diagnosed with metastatic testis cancer. This was right around the time that Larry Einhorn came to Indiana University, where he was treated with a three-drug cocktail of actinomycin D, bleomycin, and oncovin, ABO. And then he had a brief remission, progressed again, was treated with mithromycin. And then in October of 1974, he once again developed progressive disease, and Larry approached him about a new cocktail with the drug cisplatin that had never been used before in combination. And Larry's thought was to put it together with another couple drugs. So I'll just finish reading this. In October 7th, 1974, Cleland took the gamble. He enrolled as patient 0 for BVP, an acronym for the new regimen containing bleomycin, vinblastine, and cisplatin. 10 days later, he returned for routine scans, and the tumor in his lungs had vanished. He was ecstatic and mystified. He called his wife from the hospital phone. I can't remember what he said, but I told her the results. So John was the first one cured of testis cancer. Back then, it had a 5% cure rate. Today, it's 95%. He is really the hero of heroes. Last week at this time, John had asked me to come to his hospital room because he was diagnosed with metastatic cancer of a different type. And he knew that this was basically the final hours of it. And so he wanted to say goodbye to me. And it was a most touching reunion I had. 2 days ago, John passed away. So my thoughts are with him, especially his family. But also, when we think about heroes, John was one of them. And if it wasn't for him in his first treatment, Larry might not have gone on and treated other patients with this regimen. This drug, cisplatin, was experimental back then. It caused a lot of nausea and vomiting, and it didn't work in many tumors. But this was a drug that was really highlighted, approved for the treatment of bladder cancer, so Hubert Humphrey could get treated, and then in testis cancer. And it's really one of the really success stories of all success stories in terms of oncology. And it started out with this experimental drug from the NCI that was approved by the FDA. So this leads us into our guest today, Rick Pazdur, who I've known for many years. He grew up in Calumet City, Illinois, which is famous for the home of the Blues Brothers and Rick Pazdur. He got his bachelor's degree from Northwestern, his medical degree from Loyola Stritch Medicine, and then did his hematology oncology fellowship, initially his oncology fellowship at Rush Presbyterian St. Luke's, where I first met Rick, and then later finished his hem-onc fellowship at University of Chicago. From there, he went to Wayne State, served on the faculty there for about 5 or 6 years, and then joined the faculty at MD Anderson. And he was there from 1988 to 1999. And we'd like to hear about this, but for some reason, it got in his head that he wanted to go to the FDA. And so he moved to the FDA, where he was director of the Division of Oncology Drug Products from 1999 to 2005 when they created the Office of Hematology Oncology Products, and he became the director of this. And more recently, he's been made the director of the FDA's Oncology Center of Excellence. He still serves as the acting director for this OHOP. Rick is an extraordinary individual. He's been awarded a number of awards. From ASCO, got the Service Recognition Award and the Public Service Award in 2013. And the AACR has also awarded him with the Public Service Award in 2015. And he's received numerous awards, and he is probably one of the most respected oncologists that I know in the society. And it's such a great pleasure to have you here today, Rick.
My pleasure, Pat. My pleasure entirely. I look forward to the conversation.
Pat, you left out one award. He got so many awards, you can't list them all, but I was impressed. He got this award from the Massachusetts General Hospital Cancer Center, the 100 list.
Yeah, you and I, we were on that. We made the cutoff.
I have no idea what that is.
We were 1,001 list. We made that one, I think. Yeah. The only other thing I want to throw into is that when I first met Rick, when I was a resident or an intern, I think, he was on the service with Phil Bonomi, who is very important for me for my thymoma research. But there was an oncology nurse on the service, Mary Lind, who was a terrific oncology nurse, as they all are. But it turned out there was more chemistry that went on. So Rick ended up marrying Mary. And I'm sure he'll tell some stories. We'll come back to that in a little bit, too.
Yeah, this is really exciting. So let's get started. Rick, maybe you could tell us a little bit about your background and what got you into medicine in the early part of your career.
I had an interesting story. Pat mentioned Calumet City, home of the Blues Brothers. That was the orphanage in the movie, was located in Calumet City. But what you don't know about Calumet City, the real kind of nickname for Calumet City in the 50s, 60s, 40s was Sin City. And it had the honor of having the greatest number of liquor licenses in the United States. And in Calumet City, which was on the border of Hammond, Indiana, and Calumet City, they're kind of sister cities there, one in Illinois, Calumet City, and Hammond is in Indiana, obviously. There was this strip, and it was called The Strip, and it had all of these bars and floor shows with Sally Rand and gambling. And if you walked down there, which I never did as a kid, but drove down there with my father sometimes, just traversing the city, the lights were so bright. It was just like Las Vegas, basically. So you had that strip, and that went on for maybe 3, 4, 5 blocks. And then you had the rest of the city that I grew up in, which was primarily a Polish Catholic city, which I am kind of a representative of, being 100% Polish. And there were scattered bars throughout the city. In fact, my fondest memories is sleeping in bed and at 3 o'clock in the morning or 2 o'clock in the morning, awakening to people running out of a bar, which was 50 feet or 100 feet from my bedroom window. And they were screaming and yelling and cursing and everything and throwing beer bottles at each other. And in those days, obviously, as you remember, in the 60s, there was no air conditioning. So the bar was called the Tropical Inn. And let me tell you this, there was nothing tropical about it, and there was nothing in about it. Okay.
Yeah, so I can see how that background might have driven.
So this was not what I would call a highbrow area, but I enjoyed it. It was a fabulous childhood that I had. Most people don't know this, so I will share this with you because it really had an indelible mark on my life and something that really transformed my childhood and my high school years and my college years and my medical school years. When I was about in 7th or 8th grade, my father, who was basically a blue-collar factory worker, developed glaucoma, and he went blind at a very early age. And that threw the family into really not only an emotional turmoil, but also an economic turmoil. And I survived basically by getting Social Security dependent income and had to work at a very early age. I started as a dishwasher. My mother lied about my age so I could start working at a crummy restaurant in Calumet City as a dishwasher, and I worked throughout school. But that experience really made me grow up really fast, if I could say so. Okay. You didn't have a childhood. You had to be responsible because there was really no security blanket to fall back on. although my parents didn't have a lot of money, they really had a very good emotional support for me. And both my father and my mother came from very large Polish families. My mother had 9 children in her family. She was right in the middle. And so I had many cousins and many aunts and uncles, and my father had 7 children in his family, and he was the oldest boy. So there was a lot of support there, but obviously not a lot of financial support. So it really made me grow up relatively quick and really come to some of life's lessons relatively fast. Discrimination against disabled people, which I always will remember. When I was a boy, I remember going with my father walking, and obviously he had a white cane, and we're walking down the street, and people would actually cross the street to avoid us. They just didn't want to confront that anxiety. I don't know if it was discrimination or they just felt uncomfortable dealing with it. When you go to a restaurant, people raise their voices like the man was mentally impaired. That wasn't the case.
I don't want to interrupt you just for a second because I read this, Rick. I think it's important to throw out. So you graduated from high school in 3 years,
yes,
college in 3 years.
That's what I was going to say. I graduated and I worked during that time also. Okay. These jobs were not these jobs kids have now as consultants or internships. These were like real jobs as a janitor, as a gardener, as a packer in a grocery store. And you had to do it, and you had to compartmentalize your life to get things done, basically. But you were driven to do things. And I'm thankful for that experience, really. I even use it now when I'm facing turmoils in my life. I look back at that time and say to myself, Rick, if you did it then as a 12-year-old kid, a 14-year-old kid, you could do anything. So it really fostered a sense of responsibility, self-awareness, and the need to do things for yourself and get going on yourself because nobody's going to help you, in a sense. I was grateful of that.
Rick, at what point did you decide to become a physician? What in that experience really drove you into that field?
Well, I spent a great deal of time in the lobby of the University of Chicago Hospital with my father, okay? I was the primary caregiver and went with him to his doctor's appointments, and I can't tell you the number of hours I spent in the lobby of that hospital. And I was very interested in science, and I was very interested in really helping people because of that background. I really had a great deal of clarity, though. I remember when I was maybe a freshman or sophomore in high school, I wrote for the Northwestern Medical School catalog because I thought I was going to go to Northwestern undergraduate. I already decided in my own mind that that's where I wanted to go. And I just got their medical school catalog and I was thumbing through it. And I remember this vividly, sitting on my bedroom floor next to the window that was 50 feet away from the bar, basically, and was looking through the medical school catalog and seeing all these names of this doctor, head of neurology, assistant professor, associate professor. And I said, hell, if I'm going to be a doctor, I want to be one of these people. I want to be the best doctor. I want to be teaching the physicians here and doing research. So unlike most kids today that have to find themselves and like, I'm going to take, 8 years to complete college or something like that and go off to Europe to find myself, I had to be very, very focused of what I wanted to do. So I really worked very hard during that period of time. I don't regret it, as I say. I went to Northwestern undergraduate, had a fantastic experience there. I graduated in 3 years, as I mentioned. I had a special interest there that most people don't know about. The people at the FDA know about it, but I did the pre-med courses, but I had a really special interest in the field of sociology and actually was toying with the idea, if I didn't get into medical school, to pursue a PhD in sociology and become an academic sociologist. If you remember, and both of you are of this age.
Dave is, not me. Go ahead.
Okay. Dave remembers this, the Vietnam War. Okay. And this was right around the time of Kent State and closing down the schools. I'm sure you remember that, the colleges, et cetera. Nobody went into business or anything like that. It was sociology, psychology, anthropology type of things people were interested in. And my love was this field. And I did a lot of research in it. And I remember one of the professors that probably had the most influence on me, a woman called Zena Smith Blau, who was a sociologist. And I did multiple research projects and independent studies. And the first thing, when I took her first course, she assigned us a paper and she said, write about yourself. What makes you unique? And I went to see her and I said, I really don't know exactly what you mean by this. And she said, well, how different are you? And I said, well, my parents are children of Polish immigrants, and I really know the Polish community in Chicago fairly well. And she said, that's it, Rick. That's what your specialty will be. And I did multiple research projects on this area with her. Some of them were like assimilation of Polish immigrants with regard to urban-rural origins. Another one was working class youth in Chicago and mobility based on education and high school part-time employment. So that was a fantastic experience that is totally outside of what I did in my future.
We asked our listeners to submit questions because we knew you were coming on, and we did get a question that perhaps is appropriate to ask at this time. And it comes from a younger trainee who wants to know what advice you would give to a trainee aspiring to a clinical investigative career in oncology. What sort of preparation should they have? Obviously, you've got to learn all of the techniques of clinical trial design, statistics, et cetera. But what other advice would you give a trainee hoping to pursue a career in clinical investigation?
I think one's career always has to go back to the basics and have a patient focus. So what is your interest in the patient, so to speak? And that is what advice I would give them. Are you interested in a supportive care issue? Are you interested in a specific disease? I think you have to follow a passion. And that is what is most important to me. What is your passion in life? Because as physicians, we spend a great deal of time on preparing for our careers and then subsequently afterwards in our designated careers. And you really can't approach this as a job. It has to be a passion. So if you do have this, what are the questions that you really want answered? What is the field that you want to go into and make an indelible mark in? So that's what I come from. And that's something that I tell our staff is, what do you really want to do? What makes you happy? What would make you a success in your mind, not define yourself by somebody else?
Finish the story a little bit. Was it a patient then that turned you on to oncology? What brought you into oncology from?
I had a very circuitous, circular route to oncology. Oh my God, I don't know if you have enough time to hear this story, but let me start. Okay. I originally went to medical school because of my background in sociology. I wanted to become a psychiatrist because here again, I thought psychiatry, sociology, psychology, these are kind of things I was interested in until I took my first rotation in psychiatry. And it was nothing like I thought it was going to be. I saw my first patient that got ECT, electroconvulsive therapy, and I said, I ain't doing this. So I then was interested in cardiology. Loyola at that time, where I was going to medical school and where I did my internship and residency, had a huge cardiology program. That was like Cath City, USA. Everybody was just coming in the hospital, getting cast, going out of the hospitals.
With Dean Tobin was there, right?
Yes.
Mary Kay.
Yes. Mary Kay Tobin's father was the head of medicine there. And it had a huge cardiology program, an excellent cardiology program. And I really did like clinical oncology. And I was all signed up for a cardiology fellowship. The T's were crossed, the dots were placed, contracts signed and everything. And somebody said, Rick, why don't you take a rotation while you're a resident in the cath lab? We have an opening, and this would be a great time and opportunity, for you to jumpstart your fellowship. So you could come and work for us in the middle of your third year of residency for about 2 or 3 months. So I did that, and I hated it. I just dreaded it. I couldn't stand it. It was the most boring thing. I would think of every opportunity to escape the cath lab. It was the same thing over and over and over again. Inject the dye, turn on the cine machine, follow the coronary arteries. So I happened to go to a community hospital, St. Francis in Evanston, Illinois, and I met an oncologist there that had just finished her fellowship. And I really was very impressed by her clinical skills. She had finished her fellowship at the University of Chicago and worked with her there, and was just amazed by really the quality of care that the oncologists gave patients with cancer. Previous to that, I had an interest also in oncology. At Loyola at that time, we had an oncologist. His name was Keddy Badranath, and he was an excellent clinical teacher. Now that I decided I'm not going into cardiology. The first problem I have is to find a job and to find a fellowship in oncology. So I started investigating oncology programs at St. Francis Hospital there. And I went down to the gift shop and I said, I want $10 worth of quarters. And I went to the payphone, closed the door of the payphone, dialed information, and got every oncology program that I could think of, from Mayo Clinic to all of the programs in Chicago. One of my last phone calls was to Rush Presbyterian. And I said, I found the program director, Jules Harris. I don't know if you remember him. And he said, yeah, we have an opening. So I accepted the position. In the end of June, whatever it was, June 27, 1979, I started my oncology fellowship program. Now, oncology at that time in Chicago, to give you a picture of it, the largest program in oncology was at Rush, and it had a total of 12 people. And the therapy started at Rush around solid tumors, really in the endocrine therapies of prostate cancer and breast cancer. So it was a different program than most programs throughout the United States that were offshoots of hematology programs in the treatment of acute leukemia and lymphomas. So it had really kind of a different orientation. So I started my fellowship, and on the first day, I met Phil Bonomi, who had had a tremendous influence and still has an influence over me. I know no doctor that I respect more than Phil. And I think the greatest compliment that one could give a doctor is to refer your own family to him. And I've done it on numerous occasions of various cousins and aunts and uncles, et cetera. But as you mentioned, Pat, I also had the opportunity to meet my wife. And I met her, and at first we were very good friends. Okay, there was no romantic relationship. And then as time proceeded, we knew that there was something special there. And my wife was just a wonderful person. Like myself, my wife was pretty much a self-made person. She was one of 8 children, the oldest daughter. As being the oldest daughter, she had to assume a lot of the childcare responsibilities and cooking, et cetera, for all of her brothers and sisters, and taking care of the younger children. But she was an excellent student. She graduated first in her class, was a national merit finalist. And I often ask my wife, Mary, you're a nurse. Are you interested in going into medicine? I'll be happy to work with you to get you into medical school. And she said, no, you want to go into medicine. I want to go into nursing. And that was her. It was her orientation toward other people. It wasn't about the buck. It wasn't about the title. It was about the work of helping other people. And I really have to honor her mother and father, who gave her that orientation of interest. All of her sisters are nurses. Her mother was actually a school nurse and an original graduate of Rush. Well, she went to Rush Nursing School in the 50s, but had to leave because at that time in the 1950s, if you got married, you couldn't be in nursing school. They kicked you out. So it shows you how times have changed.
Well, this concludes part 1 of our interview with Dr. Richard Pazdur, who's the director of the U.S. Food and Drug Administration's Oncology Center of Excellence. Stay tuned for part 2 of this conversation, where we'll hear how cancer has touched his life personally, and we'll explore the initiatives and programs he started to improve patient care globally. Thank you to all of our listeners for tuning into Oncology, etc. This is an ASCO education podcast where we'll talk about just about everything and anything If you have an idea for a topic or guest or you'd like to see on the show, please email us at education@asco.org. Have a good week.
Thank you for listening to the ASCO Education Podcast. To stay up to date with the latest episodes, please click subscribe. Let us know what you think by leaving a review. For more information, visit the Comprehensive Education Center at education.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.